Hello, I'm Jen Benner from the National Sexual Violence Resource Center, and I'm happy to welcome you to the webinar, SARTs in Detention Part 1, PREA Basics. This webinar provides an overview of PREA and is part 1 of a two-part series. The second webinar is SARTs in Detention Part 2 Implementation. This is one of many webinars you can find in the SART Toolkit at www.nsvrc/SART Toolkit and in the SART webinar series. I would like to thank the Office for Victims of Crime for their support and funding for this webinar and for the entire SART Toolkit and the supplemental materials. We would also like to offer the disclaimer that the opinions, findings, and conclusions or recommendations expressed are those of the contributors and do not necessarily represent that official position or policies of the U.S. Department of Justice. And again, today's webinar is one of many that you can find in the SART Toolkit and in the SART Toolkit webinar series. The SART Toolkit is at www.nsvrc.org/SART Toolkit. And I am so glad that Kris from Just Detention International could join us today. And so I'm going to turn it over to Kris for their introduction and presentation.
Thank you. And I just want to let you all know that I am a program officer with Just Detention International. My name is Kris Mady, and Just Detention International, or JDI for short, is a health and human rights organization that seeks to end sexual violence in all forms of detention. It's our fundamental belief that no matter what crime a person may have committed, rape is not part of the penalty. It is our mission to hold government officials accountable, change public attitudes about sexual violence behind bars, and ensure that survivors get the help that they need. Incarcerated survivors of sexual assault are often not included in discussions on sexual abuse and response, and yet folks are assaulted in detention settings at alarming rates. Having knowledge of sexual abuse in detention and laws in place, such as PREA, the Prison Rape Elimination Act, allow us to include this important population in our discussions around appropriate responses to sexual assault. Although our detention settings are often separated from our community, we can bring this underserved population back into focus by including corrections staff and feedback from our incarcerated survivors in our sexual assault response teams. So who are we talking about when we're talking about survivors in detention? I think that we all know a lot about sexual abuse in the community, but when we're talking about sexual abuse in detention, we know that the dynamics of sexual abuse, such as in the community, exist on a continuum of violence. Our survivors experience things like sexual harassment to rape, just as survivors in our community do, with some differences such as protective pairing, gang abuse, and abusive searches. In detention settings, perpetrators may use offers of protection, threats, coercion, authority, extortion, medication or drugs, and force to commit sexual abuse. We know that nearly equal rates of sexual abuse is perpetrated by staff and other inmates. For folks that are incarcerated, they frequently have a history of trauma prior to that incarceration. So a lot of the people we're working with have experienced child sexual abuse, sexual assault, intimate partner violence, gang violence, and police violence prior to their incarceration. We are also frequently working with people who have experienced extreme poverty and who have limited access to resources. Similar to in the community, people who are perceived to be vulnerable are most likely to be targeted. So in detention settings, this often looks like folks who are younger, folks who are suffering with mental illness, people who have disabilities, LGBTQAI+ folks, and folks who have survived previous abuse. And when we're talking about these communities, it's important to know that the dynamics of sexual assault in detention might look a little bit different for them than it does in the community. And while we know that healing from trauma in detention can be incredibly difficult, as survivors have little to no control over their environment, we do know that services like the ones that you all can provide are very valuable to survivors who are incarcerated. And so in the words of Cecilia, a trans woman who is a member of JDI's Survivor Council, she wanted to let folks know kind of about her experience. And she said, although you may think that I'm not like you, we may not be so different. I want to have control over my own body and my own life, just as you do. I absolutely did not want to have sex with that man in the jail, but I felt powerless to refuse him. So I think her story, like the story of many survivors in detention, really highlights what the dynamics of sexual abuse can look like and why it's so important that our services are there for them. The Prison Rape Elimination Act, or PREA, was passed in 2003 after years of hard work by advocates and survivors. As a civil law, PREA did not create any new crimes, but instead describes a course of action to eliminate sexual abuse in detention. It states that sexual assault in detention is a violation of the Eighth Amendment of the U.S. Constitution, which prohibits cruel and unusual punishment, and requires that facilities adopt a zero-tolerance approach to sexual abuse. These standards were released in 2012. The PREA standards require that corrections facilities take concrete steps to protect inmates from sexual abuse, whether that's perpetrated by staff or inmates. There are 52 prison and jail PREA standards, each written with several subsections. The PREA standards affirm that it is the absolute responsibility of correction agencies to protect inmates in their custody from sexual abuse. At the same time, the PREA standards recognize the importance of outside agencies in supporting these efforts. Strong partnerships between corrections agencies and sexual assault service providers have the potential to dramatically improve the level of care for people who are sexually abused behind bars. The PREA standards require corrections facilities to take steps to protect survivors from those that abuse them, provide survivors multiple ways to report abuse that they've experienced, give survivors access to appropriate emergency and ongoing mental and medical health care, increase staff and agency accountability, and provide access to rape crisis services that are at the same level of care of services that are in the community. And I think PREA can be a really wonderful tool for folks to get involved in working with incarcerated survivors of sexual abuse. So when we're talking about PREA, there are often a lot of questions that people ask. For example, when we're talking about who must be in compliance with PREA standards, we're talking about corrections agencies, not outside agencies, such as rape crisis centers or medical facilities. If we're talking about who has to report the abuse, we want you all to know that outside agencies should really follow their same community standards of confidentiality. So if someone discloses something to you and they happen to be incarcerated, you should not report that unless you would do that on the outside. In terms of abuse that occurs prior to incarceration, the PREA standards do cover that as well. As I spoke about before, a lot of the survivors we're working with have experienced abuse prior to their incarceration. PREA also covers sexual harassment that occurs within the facility. So these are just some of the few things that we often hear that there is some confusion about, and we want to make sure that you have a strong understanding of this. One of the deepest parts about PREA that I think involves SART teams is that PREA calls for a coordinated response to sexual abuse. So how can this be a part of our response that we're doing in the community? How can we integrate the two? So part of PREA calls detention facilities to have a planned coordinated response to sexual abuse that occurs within a facility. And this should include individuals and organizations from community SARTs. This coordinated response may and should include staff first responders, medical and mental health practitioners, investigators, and facility leadership so that a survivor receives appropriate care post-assault. To learn more about coordinated response and how SARTs can be used to help implement them, please check out part 2 of this webinar series. Under PREA standards, any inmate who reports being sexually abused must be provided with timely, unimpeded access to emergency medical treatment, crisis intervention services, and ongoing medical and mental health care. The standards also mandate that corrections agencies provide inmates who are sexually assaulted with information about and access to emergency contraception and care for possibly sexually transmitted infections. If applicable, pregnancy tests and information about rights to lawful pregnancy-related medical services following a rape is also mandated. A survivor should have access to these services, even if they do not provide information about the perpetrator. Under PREA, all reports of sexual abuse in detention must be taken seriously and be investigated fully. Who investigates sexual abuse in detention depends on the type of facility and who has perpetrated the abuse. If the abuser is another inmate, the standard of investigatory process begins. This generally looks like a grievance being filed, and the Investigative Service Unit, or ISU, will begin the investigation. The investigative unit ultimately decides whether a report is substantiated or unsubstantiated and refer reports to district attorneys or internal disciplinary bodies. Building relationships with ISU investigators can be incredibly helpful since ISU staff initiate forensic exams and are typically responsible for ensuring an advocate is made available. For county jails, which are run by the Sheriff's Department is responsible for investigating crimes within their facilities. If the abuser is a staff person, a separate department is called in to investigate. Similar to in the community, Internal Affairs investigates any abuse or wrongdoings done by law enforcement. Detention facilities are no different. PREA requires that incarcerated survivors are provided access to emotional support services, including rape crisis center services. Advocates generally provide 3 services to survivors in the community: crisis line support, hospital accompaniment, and in-person counseling. Detention facilities, and therefore inmates themselves, tend to be very isolated from the community. Because of this, one of the main ways prisoners communicate with the outside world is through mail. Therefore, written correspondence is a 4th service rape crisis centers can offer to incarcerated survivors. With the appropriate training, commitment, and planning, all of these services can be provided to incarcerated survivors. PREA offers several avenues where SART members can get involved in serving incarcerated survivors. It is so important to include all survivors and their experiences, including those in detention, into our SARTs so that we can better respond to survivors and work together to end sexual violence. In the words of Joe, a member of JDI's Survivor Council, he said, "Getting in touch with an advocate saved my life." And this is where you can get involved. You can work together with your SART teams to serve incarcerated survivors behind bars. And so I just want to point you to a few resources that you may be able to use to further your work with incarcerated survivors. The National PREA Resource Center is a really wonderful resource where you can learn more information on the Prison Rape Elimination Act. We encourage you to check out their website and learn more about the PREA standards and where you fit in. We also encourage you to connect with us through our website, Facebook, and Twitter. Also look for part 2 of this webinar series to learn more about building SARTs in detention settings. If you have any question in regards to serving incarcerated survivors or working with corrections around sexual abuse behind bars, please reach out to us. You can always direct questions to advocate@justdetention.org.
Great, thank you. Thank you, Kris. And this is how you can connect with NSVRC. You can connect with us at www.nsvrc.org. You can also connect with us on our social networking sites. And we also want to say, again, a big thank you to our presenter and to ODC for making this presentation and the entire SART Toolkit possible, and to you for all the work that you do to support survivors and hold offenders accountable.